On the heels of Health Minister Dr. Frank Anthony announcing that Guyana is incapable of testing for the new COVID-19 variants that have emerged in England and South Africa, Eureka Medical Laboratory via a press release on Monday had indicated that it can test patient samples for the new coronavirus variants. In an exclusive interview with Nightly News on Tuesday, manager of the virology department at the Eureka Medical Laboratory, Paul Chetty, explained that while the laboratory's machines cannot definitively identify whether a person has been infected with a new strain of the virus, there are some attributes of the polymerase chain reaction PCR test that can indicate the presence of the strain.
There is a characteristic of the test that allows us to presumptively know that the person may be infected with this new variant. Because our test is identifying 3 genes for the virus, and based on what we've seen, if one of the genes is absent, it's a good indicator that this person may be infected with this new variant of the virus. But it's not always the case, but based on what they've said, in many instances, it is the case, yes.
Eureka Lab has also been contracted to facilitate PCR COVID-19 testing services at both the Chetty Jagan and Eugene F. Carrier International airports. Chetty informed that detecting the new strain requires advanced assessment of the samples, which are currently not being done in Guyana. Infectious disease researchers in Toronto and other parts of the world are using genome sequencing to track down the new variants of COVID-19.
That requires a whole different platform. Our platforms are really just PCR to look for the genetic information of the virus, not to see what the entire genomic information is saying. So that's the purpose of sequencing, to look at all of the genes. We're just looking for specific targets associated with that virus.
The local suspected cases were identified within the last month. To date, new variants of the coronavirus have been identified in England, South Africa, and Nigeria. Chetty underscored the need for Guyanese to adhere to the precautionary measures to keep the virus at bay, even as it mutates around the world.
Because of this new variant, especially South Africa, I know a lot of information hasn't come out publicly because we're busy talking about the UK, but especially the South Africa strain, what they've seen is that not only is it more infectious for adults, which was the major population being affected, there is some indication that it's more infectious for children. So that is the major implication of this new variant. So not only young children, but also adolescents.
Timeka Rodney reporting for the HGP Nightly News.